Wound dressing. Introduce yourself and explain the procedure to the patient. Gather supplies to be used for dressing change.
Swabs, forceps, bandaging tape, bandages, povidone iodine.
Wash your hands or use hand sanitizer. Abdominal wound dressing. Prepare a biohazard bag and place it on the bed or table. Put on clean gloves. To remove tape, hold down the uninjured skin. Pull the tape parallel to the skin and toward the dressing or in the direction of the hair growing in a hairy area. Remove any adhesive that remains on the skin. Using your gloved hand or forceps, carefully remove the dressing. If a drain is present, avoid putting tension on it and carefully remove the dressings one layer at a time. Discard the soiled dressing in a waterproof bag. Thoroughly examine the wound. Note the wound's size, color, odor, and type of drainage. Dispose of your gloves in the bag and perform hand hygiene. Open the sterile dressing tray, place your sterile dressing drape, and arrange your dressing supplies in order to be used. Open the prescribed cleansing solution to be used. If you'll be using forceps, put on clean gloves. If not, you may need to put on sterile gloves. Cleanse the wound working from the least contaminated to the most contaminated areas, such as from the wound edges out to the surrounding skin. Use a separate gauze pad or swab for each cleansing stroke. If a patient has a drain, use a circular stroke starting near the drain and cleansing outward and away from the insertion site. Use dry gauze to blot the wound with the same technique you used for cleansing. If an aseptic ointment is ordered, apply it using the same technique as for cleansing. In dressing the wound. To apply a dry dressing, position the gauze as a contact layer. On top of this, apply a thicker woven pad. If a drain is present, use a pre-cut split dressing. Secure the dressing by applying the tape perpendicular to the wound or at the right angle to the direction the joint moves. Make sure the tape extends past the end of the dressing, sealing the dressing edges. Scalp wound dressing. Once the wound has been washed, it can be dressed again. Ointment dressing. Awkward wounds, such as the hair-bearing scalp, may simply have ointment as a dressing. This should be applied several times daily to prevent the wound from drying up. Either use Vaseline or a prescribed ointment. If prescribed, You may be issued with a spray dressing and instructed how to use it. Hand bandaging. If a wound is present, clean and dress it before bandaging. If the hand will be bandaged for a long time, place rolled up gauze between the fingers to keep moisture from gathering between them. With the patient's hand palm up in front of you, place the end of the bandage on the inside of the wrist and wrap it around the wrist twice. Bring the bandage across the ring, middle, and index finger, making sure the fingertips are exposed. Bring the bandage diagonally across the palm of the hand towards the outside of the wrist, completing a figure 8 around the hand. Repeat the figure 8 a few times, staggering the position of the bandage so it doesn't bunch up on each pass. Use binding clips or apply a strip of adhesive tape to keep the bandage in place.